PYODERMA in ulcerative colitis. Definition. PYODERMA is an abstract intestinal manifestation of inflammatory bowel disease that can be therapeutically troublesome. Video.
Pyoderma gangrenosum, an ulcerating condition of skin that results in heaped borders with a typical appearance. Pyoderma gangrenosum appears to be mediated by the immune system, but the exact cause is unknown. The lesion usually begins as a soft nodule on the skin that then ulcerates. The ulcer enlarges, and the skin at the edge is purple-red. The ulcers can become quite large. Pyoderma gangrenosum is associated with several other diseases, including ulcerative colitis, Crohn's disease, rheumatoid arthritis, leukemia, and cryoglobulinemia. Pyoderma gangrenosum.
Ulcerative colitis is a long-term condition where the colon and the rectum become inflamed. The ulcerative colitis is a disease that affects your large intestine or colon. It causes irritation and swelling called inflammation. Eventually, that leads to sore called ulcers in the lining nerve. It is a type of inflammation bowel disease, but is different from other diseases with similar symptoms like Crohn's disease or irritable bowel syndrome. There is no cure yet, but people usually have symptom flare-ups off and on for life. The right treatment can help you to handle this disease. Video.
Inflammatory bowel disease can cause inflammation in the small and large intestine. In other words, inflammation of the bowel. Colitis refers specifically to inflammation in the colon, or the large intestine. Ulcerative colitis is a type of inflammatory bowel disease that tends to form ulcers along the inner surface or lumen of the large intestine, including both the colon and the rectum. These ulcers are spots in the mucosa where the tissue has eroded away and left behind open sores or breaks in the membrane. Sometimes there's a flare, which means that new damage has happened, and then there are periods of remission when the tissue starts to heal up. Ulcerative colitis is actually the most common type of inflammatory bowel disease. Not that there are that many, but this one causes inflammation and ulcers in the mucosa and submucosa of the large intestine only, which is an important point that sets it apart from Crohn's disease, another inflammatory bowel disease. Now, although certain environmental factors like diet and stress were once thought to be the culprit behind these ulcers forming in the gut, now it's thought that these are more secondary, meaning they seem to make symptoms worse, but ulcerative colitis is now ultimately thought to be autoimmune in origin. In fact, cytotoxic T cells from the immune system are often found in the epithelium lining the colon. So the thought is that inflammation and ulceration in the large intestine is caused by T cells destroying the cells lining the walls of the large intestine, leaving behind these eroded.
Application in nursing. This kind of disease can be difficult to be treated. That's why nursing have a very important image in this situation by setting all the aims of nursing out that are promoting health and preventing aggravation in the disease of the patient. Video.
Welcome to the Health Channel. Pyoderma gangrenosum is a fairly rare skin condition that affects both males and females. It is not age-defined, but it is more common in the young to middle-aged group. The most likely affected areas are usually the legs, arms, and neck, although it can also develop on the head or genitals. Even though Pyoderma gangrenosum is a skin infection, it can bring on high temperature and feelings of sickness. The first indication of Pyoderma gangrenosum is usually the appearance of small red bumps or pimples that quickly grow larger. Creams and medication with positive results, but there is a high possibility of scarring. It is important that you consult a doctor or skin specialist before attempting to self-treat, as pyoderma gangrenosum is quite a serious condition and should be treated.
Pros and cons. Pros. This condition can be treated. The right treatment can help you to keep a handle on the disease, so like the skin lesions can be managed with daily honeymoon dressing and oral dapsone, midazoline therapy, and prednisolone. The cons. Pyoderma gangrenosum is a rare inflammatory skin condition. That's why there is no cure yet, and people usually have symptom flare-ups on off and on for life.
We've shown you photos of some extreme medical conditions over the years, and today we have some of our most shocking yet. It's time for What is this? What happened? And could it happen to me? So let's start with this picture. And as you all try to figure out what happened and could it happen to you, Dr. Batra, what did happen?
So this is actually a very zoomed in picture, and I think if you go back, you'll actually see the part of the normal skin on the breast. This is a condition that's really quite rare. It's called pyoderma gangrenosum, and it's a condition where when you have an injury to your skin, in this case, the picture is taken from a woman whose photo went viral. She was scratched by a cat. But what happens is all of these inflammatory cells rush to try and heal the injury, but they get stuck, and there are an overabundance of cells called neutrophils. And the way I always kind of think of this in my mind is like when there's an accident and all the bystanders are in the front lines, that the first responders can't get there and actually fix the problem. That's what's happening here. You actually have all of these inflammatory cells that are not meant to be there crowding out the actual wound healing that's meant to occur. So anytime someone gets an injury, it just becomes this horrible, painful, non-healing ulcer. And this is actually really challenging to diagnose because you have to rule out all sorts of infectious causes and other possible reasons for this. You have to diagnose this on biopsy. It's much more common in people with other autoimmune conditions or certainly inflammatory bowel disease. And it's treated by very long courses of anti-inflammatory. So sometimes we were just talking about a couple of cases of mine in my clinic where it's taken months to years of long-term steroids or anti-inflammatories to actually make this get better, and does heal with pretty significant scarring.
Issue supply in Ecuador. In Ecuador, there is not much articles or information of case about this disease, even though approximately 30% of the cases of PG develop in patients with inflammatory bowel disease. Evidence has 4 cases report of PG developed in chronic UC patients have been published in 90 Theory. Several reports have suggested that the development of PG was closely associated with active usage of Crohn's disease. However, in a study of 87 patients with PG, there was no consistent relationship between PG disease course and that of other associated diseases, including UC. As such, the relationship between the clinical course of PG and UC remains controversial. Video.
I've had pyoderma gangrenosum for 10 years and 1 month. I was treated for venous ulcers for 5 of those years. That involved triple layer bandaging, being told not to get the ulcers wet, and the surgeon wanting to remove my non-existent varicose veins.
Pyoderma gangrenosum is a rare and very painful skin condition that causes rapidly spreading ulcers on the skin. It's an autoimmune condition that's also associated with other autoimmune conditions such as rheumatoid arthritis.
Conclusion. The pyoderma gangrenosum is a rare inflammatory and non-infective and non-neoplastic skin disorder. PG is often associated with systemic conditions such as inflammatory bowel disease, rheumatic arthritis, paraprotein anemia, and hematology malignancy. The precise clinical and pathologic physically association of PG with an underlying system disease is currently unknown. Conventionally, it was thought that the PG was not a manifestation or complication of this disease, and the relationship of the PG and combined disease during the clinical course is not fully understood. We rarely report a patient with current PG, the clinical course of which was correlated with the underlying ulcerative colitis. The patient was treated with maxilin and her symptoms rapidly resolved. Video.
Pyoderma gangrenosum is a non-infectious, progressive, necrotizing skin condition. The etiology of pyoderma is unclear. Half of patients have a systemic inflammatory condition, such as ulcerative colitis, Crohn's disease, irritable bowel syndrome, lupus, or rheumatoid arthritis. About a quarter of pyoderma cases begin after some sort of trauma or surgery, but another quarter have an insidious onset. Pyoderma most frequently affects patients who are middle-aged. The pathology of pyoderma gangrenosum is poorly understood, but is believed to be due to neutrophil dysfunction. The classic presentation of pyoderma gangrenosum begins as a small, very painful papule, vesicle, or pustule on the lower extremities and/or trunk. While a single lesion is possible, generally there is a cluster of ulcerations that rapidly expands. Pyoderma rapidly progresses to full-thickness ulcerations with irregular, violaceous borders which have purulent and hemorrhagic exudates. Undermining is common. The wound bed is eschar or slough covered, and the wound edges may be rolled. The peri-wound is indurated or boggy. The patient may also to control inflammation. Local wound care includes gentle and limited debridement of slough and necrotic tissue. Extensive sharp or surgical debridement is contraindicated because it increases the inflammatory response, leading to severe exacerbations. Topical antimicrobials are indicated for sensitive bacterial infections. Gauze or moisture-retentive dressings should absorb wound exudate and protect the surrounding tissue. Extremity wounds may benefit from elevation and gradient compression. Negative pressure. Wound healing is extremely slow. Because recurrence is common, physicians generally continue pharmacological management for 6 to 12 months after wound closure.
Thank you.